We're here in Gustine, California. We've actually moved here in 2013. We moved to this location. We were in Modesto before that. We milk about 2,000 Holstein cows. We ship our milk to Hillmar Cheese. My dad and I are in partnership together. It's a family business, family operation. I'm actually the fourth generation. Herd health is a big thing that we're pushing for here. We want to try and make sure that the cows are comfortable, obviously, healthy, well cared for. The more comfortable and well cared for the cow is, the better she's going to produce. We do strive a lot to look for good genetics and breed a good cow and strive for higher production levels, higher efficiency levels. We've done fans over the last couple of years. That's really helped a lot in the heat stress. Recently remodeled one of our pre-stall barns. It was kind of a lower pitch roof, so trying to aid in the comfort of the herd to help breeding, help reproduction, help milk production, and so on. A few years back, we had somebody from AHV stop by as a sales rep, looked into the product. They were kind of talking to us about how it worked, the theory behind it. But it was interesting technology and quorum sensing and how it enables the cow to, rid that biofilm so her antibodies can actually attack and get rid of the infection. Last year, in March, I think it was, we started with AHV. We did a trial. We were using typical antibiotic intermammary treatment. We were having decent success with it. It was working. It was working okay. The sales rep had kind of challenged us to look at the cost of the lost milk, and the cost of the treatment, and the recurrence of cases, and so on, and what we were using. And when you factor in the days in the hospital and that lost milk and the percentage of cows that actually come back for mastitis, we were one cost treatment for AHV products versus the other products. We were apples and apples. The hospital pen has been quite small. It's nice, going from 20-something cows in the pen to 8 or 10 or 6, or we've actually had no cows in the pen for a couple of days now this year, so that's been the first time we've ever had that. On the fresh cow side, we do use the Vetri pill, just kind of on case-by-case basis. If they have an RP, say they calve on the 20th, and on the 21st they have an RP, we give them a Metri pill. The 22nd, if they also have an RP still, we give them the 3 pills, and most of the time that takes care of it. I think we're saving about 20 or 30 bucks per cow on the AHV product with that route. It's pretty much apples to apples on the cost per clinical case, but the turnaround and everything else, and not having to worry about having a cow accidentally slip into the tank or separating the guys with the milkers, that's been a big help. That's always kind of a concern, is antibiotic resistance. People talk about, especially veterinarians, they'll mention it, and we do use a blanket dry tube treatment for right now. You got similar types of antibiotics that go into the dry tubes that also go into the mastitis tubes, and are those being as effective as they were when they first came out, and is there a thread of antibiotic resistance passing on through the milk and so on like that with the calves and the hospital milk that they get as well. So not having to have that as a part of a concern. We haven't had a mastitis tube on the place since we've switched to AHV. The dry cow tube that she gets, it's the first time she's seeing an antibiotic. There's less chance of antibiotic resistance, not having to worry about cows being separated due to antibiotics and not having to worry about that. That's been a big plus. So when we switched to the AHV products, it was a little different mindset as far as, okay, we're not tubing cows in the barn, but we're checking the cows, we're milking them out, we're stripping them out, which are good things to do anyway, right, for mastitis treatment. We still do the same with the Monday. We're stripping the cows. Tuesday, we still treat the cows, so we'll sample them, just checking for contagious bacteria. Not so much culturing, gram-positive, gram-negative, just checking for contagious. So I lock them up after they come out of the barn, give them the pills, and even the curb lickers, we're able to get those locked up and treat those. Giving the pills isn't difficult at all. It's a re-pilled tuber that'll fit 3 or 4 pills, so if you got to give a booster or the regular 3 pills, it goes quite easy. The case is very mild, like just a few flakes. Oftentimes I'll just give her an extra and then let her out that same day. If it is gargets, we'll give them the 3 pills. If she's got a more severe case, we'll also give her a booster. And then we're just checking the milk until it's clean enough to go out. Our average so far has been about 2.5 days in the hospital per case, and that kind of includes, the cow that ends up getting another treatment at day 5 or 6. The recommended protocol was day 7 recheck, and if she still has mastitis, treat her again. For us, I found that by day 5, if she's not cleaned up by day 5, she's not going to get cleaned up by day 7. So day 5 is kind of in an effort to get her out of there sooner. So on those repeat cases, when they do happen, that's been it. I'm checking the milk to make sure that she's clean enough to go back out to the pen, and then when she's clean enough, we kick her back out to the milk string Again, we average about 2.5 days in the hospital, which is a big reduction. The today tubes, we were seeing 7 days in the pen. That's a big savings on milk. When you look at the cost of lost milk and everything else, that really swings the pendulum. And like for us, it was within $1 per treatment case to go AHV versus the tube when you look at the lost milk, days in the hospital, and the labor and the antibiotics. So we were about that $135 versus $134 on those 2 treatment cases. So for us, as far as an ROI, it wasn't necessarily on the whole business scheme, but more just on that individual mastitis case, on the clinical cases, that kind of made us, okay, let's give it a shot. Let's give it a good solid shot and try it out, and it's worked quite well for us.